This is Bonnie, 58-year-old, correct? Female, hard to believe. And again, looking at the temples in this area, the key landmark that we want to identify in the beginning is the temporal fusion line. You can see it quite nicely on her. She has quite a pronounced temporal depression in the area, so I'm going to put a mark right along the temporal fusion line. Looking at the posterior boundary, it is the scalp line. Looking at the anterior boundary, it is the lateral brow right along the lateral orbital rim in this area. And the inferior boundary is the zygomatic arch, which is in this area. Now, of note, there are vessels that run through this area. The temporal vessels are superficial vessels. We do not want to disturb them. That is why we are injecting on a periosteal, the supraperiosteal plane, which is an avascular plane in this area. In this area, within 1 to 2 centimeters superior to the zygomatic arch, lies a vein called the sentinel vein or middle temporal vein, and we do not want to inject in this area. So the zone that we inject in is in this area, and in general the rule that we follow is along this temporal fusion line you go up from the brow about 1 centimeter, and then you go lateral inferior about 1 centimeter right in this area right here. So that is the spot for injection. So at this point I'm going to have you just rest your head back there, and I'm going to clean Bonnie with a little bit of antiseptic here. That was just a little chlorhexidine wipe. I'm using a little alcohol at this point. Great. And this is a 27 gauge ½ inch. Okay. Looking very carefully at the vessels that I can see in this area. Go about 1 centimeter up, 1 centimeter over. I'm going to come right in here. You're going to feel a little tiny stick, Bonnie. Okay. And we're already on periosteum. You don't need to use a lot of force. I can feel right there. And then we reflux. I'm going to keep it there for about 5 or 10 seconds to make sure that there is no vascular reflux. We see none whatsoever. I'm going to hold the thumb along the hairline so there's not too much flow of product in the posterior direction, and I am going to inject very, very slowly in this area. Most patients will describe a feeling of discomfort that is more pressure than it is pain. How you doing there, Bonnie?
It's okay.
Good. How much pain are you having on a scale of 1 to 10?
Like 3.
A 3.
Not even.
Okay. And that will start to go away as well because there's lidocaine that is in the product. And you can see the temporal fossa rising quite nicely with our product here. It's very obvious. And I'm going very slowly. There's no rush here. Keeping the needle steady right on periosteum without too much pressure. I'm done injecting now, so I remove my thumb from the plunger and then gently pull out, okay? No bleeding whatsoever. And I'm going to massage the product a little bit into place. And at this point, before I put more product in, I always like to come around and look at her side to side. She has a deeper fossa in this area, so we're going to put 2 syringes of Voluma on each side. You doing okay?
Mm-hmm.
Great. We're going with the second syringe in the same area. It doesn't have to be exact. It's not exactly 1 centimeter up and 1 centimeter over, but in this general area, and remembering that we want to avoid injecting deeply 1 to 2 centimeters superior to the zygomatic arch, okay? I'm going to come just a little bit this way, a little tiny stick, okay? And again, I'm going to reflux and keep it there for 5 to 10 seconds. Make sure that there is no vascular reflux. And then again, very, very slowly, I'm going to inject the area. again, slow injection is always quite important to avoid trauma. Now, because we're injecting periosteally underneath the temporalis is a component of the TMJ joint. Some patients will say that they can feel some soreness in their TMJ joint for a couple of days after the procedure. I always advise them of that. Some Tylenol or non-steroidal anti-inflammatory is fine. If it is bothersome, it goes away. And that is our second syringe. Great. And I'm going to massage. We see little to no bleeding, maybe just a touch there. I hold a little bit of pressure for a moment to make sure that it stops. Great. Beautiful. And at this point, we will allow the camera, still maybe just a tiny little bit of bleeding there. Important to actually hold it for 30 seconds or so. So we have held pressure for about a minute or so. Bleeding has stopped, okay? And then I just like to massage the product in a little bit in the area. Great. Okay, and she's someone who is so hollow that she might even like another syringe. I usually do not put more than 2 syringes in at any time in one temple. We can touch her up again in about a month or so. Okay, so we can go ahead and get some midstream photos here. Treating the left side here, we're going to identify the temporal fusion line. I can feel it quite nicely right here. Draw a line there. We can see her superficial vessels a bit more obviously around here. Again, about 1 centimeter up, 1 centimeter over. She does have a few superficial vessels lying in this area. I may go slightly in this area to begin with where I don't see any. Okay. So putting just a touch of antiseptic in the area, chlorhexidine wipe. Great. Right. And again, about 1 centimeter up, 1 centimeter over, searching for an area where there are no superficial vessels. About right here, little tiny stick, Bonnie. Okay. We're on periosteum. I am refluxing. You can see that, and I will keep it there for several seconds. Right. And then we will inject very, very slowly here on the periosteal plane. You okay there, Bonnie? Mm-hmm. Feel a little bit of stinging, and then the lidocaine that is contained in the product kicks in. And you can see the tissue rising as I slowly inject. And I'm keeping my needle very still, sitting right on periosteum, not moving. We do not want to move it out of place. I reoriented just a little bit there, so I refluxed. And you can see the fossa filling up very nicely. You doing okay, Bonnie? Mm-hmm. Great. Beautiful. And that was 1 syringe in that area. No bleeding whatsoever. I'm just going to massage this into place. Okay. And then we will go on with our second syringe. I'm going to go in right at the same entry point. That was a good one. Right. Again, refluxing. Right on periosteum, injecting very slowly. And you should feel very little at this point, Bonnie, right? Mm-hmm. Good. And again, I'm being very mindful. Watch the speed of my plunger here. Not very fast at all. Taking our time and no rush. I think that's a good rule for all fillers, actually. Okay, you see that my thumb is off the plunger as I pull out. No bleeding whatsoever on this side. I will massage and clean the area, and then we will be finished.